Welcome back. The first potential vaccine for coronavirus is now in trials. At a White House coronavirus briefing yesterday, Dr. Anthony Fauci told reporters that healthy volunteers in the Seattle area became the first to test a remedy for the rapidly spreading disease.
What it is, it's a trial of 45 normal individuals between the ages of 18 and 55. The trial is taking place in Seattle. There will be two injections, one at 0 day, first one, then 28 days. There will be three separate doses, 25 milligrams, 100 milligrams, 250 milligrams, and the individuals will be followed for 1 year, both for safety and whether it induces the kind of response that we predict would be protective.
Scientists at the Kaiser Permanente Washington Research Institute are conducting the first stage study, which is expected to take up to 18 months to complete. Joining us now, emergency physician and public health professor at George Washington University, Dr. Leana Wen. She previously served as Baltimore's health commissioner. I think as we work to spread the word, and clearly the president's tone, Dr. Wen, yesterday was far more serious. Asking people not to gather in groups over 10 people is a big change and could potentially shut down a lot of society. So what can families do? What are the things that you are most worried about as the word trickles out and people start getting the message?
Well, I'm glad that the president is emphasizing the importance of flattening the curve, of all of us taking our part and staying at home. I'm glad that that message at least is getting out there. But there is so much that we have to do. Look, I'm seeing stores being shut down, schools being closed, but people are still congregating. We shouldn't be treating this like a snow day. Kids should not be going on play dates. We should not be having birthday parties and celebrations. Everything should be placed on hold. And I think this is a time when each of us has to take that responsibility as well. Dr. Fauci said yesterday that we will always be behind where we think we are, and we just all have to take part now.
So I want to know what that looks like. You're a mom running a household. You've got parents to take care of. You've got kids who are just going nuts and want to go out and play with their friends. Exactly how does it work to be able to take the best advice from doctors and social distance as a family? What does that look like?
So it's important to tell everybody in the household that this is not life as usual, that these are extraordinary times and we all have to make sacrifices. And that means no play dates. I know that it's hard with kids who are restless at home, but find some projects, do things together as a family, spend time outdoors as a family unit, but don't get together with other people, including extended family. In particular, I would keep little kids away from elderly grandparents and others who have chronic medical conditions, and try to limit your trips to grocery stores. Don't go to coffee shops, restaurants, other crowded places. Really think about what are the absolutely essential things that you need. Take those essential trips. But
you're asking all Americans to completely isolate. When you say no play dates, no children playing together, that's complete isolation from society.
Well, it doesn't have to be if we use FaceTime, Skype, other electronic methods of communication. I mean, the whole reason that we're closing down schools is to prevent kids from interacting with each other and spreading germs to each other. Kids are taking huge sacrifices, especially kids who depend on their schools as their only meals. If they're making that sacrifice, then the least that we can do as people who have a bit more privilege is to keep our kids away from each other. I mean, other people are making much bigger sacrifices than us, and we need to do our part too.
So, Doctor, let me ask you about, we've talked about the president's tone being more sober yesterday. That's one day. And let us hope that he follows that press conference with a sober press conference today. But that's just one day. But let's say that the federal government begins to move forward aggressively, has these recommendations, that Americans follow your advice. Because I must say, I've been stunned that my children have been asking me if they could go to parties and restaurants over the past 2 or 3 days. Birthday parties. It's staggering, and you wonder what parents are still setting up birthday parties at this stage. But if we self-separate, like you're talking about doing, do we have a chance to avoid Italy's fate? Can we move the curve closer to South Korea, even with the failure of testing over the past month and a half? Can we move that curve closer to South Korea than, say, Italy?
Yes, we can. And that's the reason why we all have to act now. It's not too late. But it will be too late in 2 weeks. It will certainly be too late in 3 weeks. And I don't want us to look back and say, here are all these things that we could have done. I mean, I think governments can do their part and close down shops and close down events, but people have to take responsibility too. It's just totally irresponsible at this time to go to a celebration, to go drinking with friends, when we know that people's lives are going to be at stake. And that window of opportunity to intervene, to flatten the curve, that window is closing every single day. And what looks like an overreaction now is going to look like not nearly enough in 2 or 3 weeks' time.
Dr. Wen, it's Willie Geist. Thanks for being here this morning. The president and the task force that he has assembled yesterday was in the briefing room, stopped short of calling for a national quarantine. In our last hour, we had Dr. Jha of Harvard saying it's taken him a while to get to this place. He's been thinking about it the last couple of days, but it is finally now time for an Italian-style national quarantine where everybody just stays home. Do you agree with Dr. Jha?
I think we should have a voluntary quarantine. I want to see what happens if everybody just takes that responsibility and does it without something that's so rather draconian. I mean, public health is always about balancing the interest of the public versus individual liberties. But there's something that each of us can do now to avoid that kind of national shutdown. And I just fear that people are not doing nearly enough. And I understand the fear and panic that people may have, but this is not life as normal. We are at a war against this virus, and we need wartime measures, including things that each of us have to do, sacrifices that we each have to make.
Dr. Wen, it's Donnie Deutsch. We've talked a lot about kids. I want to talk about the psychological aspect. We know what to tell them as far as what they can't do and very structurally. How do you handle an 8, 9, 10-year-old with getting them where we need to be without terrifying them? Is there a phrase, is there a way of serving this up to get the job done at the same time, not terrify kids that really can't process it?
It is really hard. I think it is important to explain to kids the facts and, depending on their age, talk about what this virus is, that most people who have it will be healthy and will recover, and especially kids. This doesn't seem to particularly affect kids. But I think it's also important to lay down what needs to be done and why that's the case, and talk about the importance of spending time together as a family, but not seeing their friends, at least not in person. And maybe it's time to also build some fun projects and doing things together as a family that may help kids also cope in this particularly stressful time.
All right, Dr. Leana Wen, thank you. And also at knowyourvalue.com, we're going to post later today her thoughts, Dr. Wen's thoughts on what women need to know and do during the coronavirus outbreak.
Well,
thank you.
First of all, let me just say, she gave great advice for parents, for fathers and
that was
mothers.
Incredible.
It's really important that when our children are coming to us and asking, hey, can I go to a birthday party? Can I, the answer has to be no. And again, I'm hoping that more parents understand the situation that we have right now and actually are not endangering their children and others' lives by continuing to have big celebrations in restaurants. We're past that time now.
Totally.
The time will return again at some point, but between now and then, we all have a responsibility to each other. To be safe and to be cautious and to take care. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.